Being infected with COVID-19 and then enduring a 2-week quarantine is bad enough, but for some people, it is just the start of the struggle. Just when you thought your life's going to go back to normal after testing negative for COVID-19, you realize that the only thing that changes is the test result. There's nothing more frustrating than that. If the annoying symptoms of COVID-19 persist even after testing negative for COVID-19, then you might be in it for the long haul. So what exactly is long COVID? What are its causes and symptoms? And is there a way to stay clear of this pesky condition? Stay tuned as we look at the answer to these questions and much more. The never-ending COVID. Who would have thought that a virus outbreak could occur in the 21st century? It all started from Wuhan City in China, where an outbreak of respiratory illness got the attention of the world. The WHO took notice of the new virus on December 31, 2019. Within a month, COVID-19 was declared a global health emergency. Despite imposing travel bans and import restrictions from China, the spread of the virus was so fast that soon it covered the entire globe. On March 11, 2020, WHO declared COVID-19 a global pandemic. As of March 2022, more than 472 million people have already fallen prey to this virus, and over 6 million people have lost their lives. Although the rapid spread of the virus has stopped to some extent, numbers are still increasing. It is generally believed that it takes around 2 to 6 weeks to recover from COVID-19 symptoms. I mean, that's how long it usually takes for the virus to pass through our system and get that much awaited negative COVID-19 test, right? That is true generally, and the majority of the people manage to recover completely. However, it isn't true for everyone. Some people continue to experience the symptoms even after testing negative for anywhere between 4 weeks to 6 months, and even longer sometimes. The term coined for this is long COVID, or COVID long hauler. Although the worst may already have passed for the long haulers, the mild symptoms of COVID still continue to haunt them. The WHO announced the first official definition of long COVID on October 6, 2021, calling it the post-COVID-19 condition. According to the official document released by WHO, long COVID occurs usually 3 months from the onset of COVID-19, and the symptoms last for at least 2 months. However, according to the Center for Disease Control and Prevention, the long COVID symptoms could start to manifest 4 or more weeks after first contracting the virus. Causes. Unlike any other disease, there is no particular pattern for long COVID, but then again, we still don't know much about this virus. This condition could affect anyone who has been infected with COVID-19. A young boy is as likely to encounter it as an old man. The prior health of a person is also irrelevant, and so is the intensity of COVID-19 symptoms. Studies show that 10% of the COVID-19 victims, whether hospitalized or not, go on to develop long COVID symptoms, even if you were one of the lucky few who didn't experience any symptoms in the first few weeks of getting infected. You could still develop the symptoms for long COVID. A study conducted in 2021 found that more than 3/4 of COVID-19 patients in a hospital in Wuhan, China, were still experiencing at least one of the symptoms of COVID-19 6 months after their discharge from the hospital. Similarly, a study from Italy found that 87.4% of COVID-19 patients reported experiencing at least one of the symptoms 2 months after their discharge from the hospital. Hence, it could be said that the likelihood of long COVID is far greater for the hospitalized patients than the ones who experienced mild or no symptoms of COVID-19 at all. Although it is still unclear why the symptoms continue to persist even after testing negative for the virus, certain theories continue to surface from time to time. One such theory suggests that the virus doesn't completely leave the patients with long COVID-19 symptoms, and it remains in their body in some small form. Another theory suggests that the immune system is the culprit behind the symptoms of long COVID patients, as it continues to overact even after the initial infection leaves the body. Another theory suggests an opposite reason for the symptoms, stating that the symptoms persist due to a lack of response from the immune system. Some people think that it might be due to reinfection of the virus, and some think that post-traumatic stress might be at play here. In the end, these are all just theories, and there's very little, if any, research backing these claims. Symptoms. The list of long COVID symptoms is a long one indeed. Most commonly reported symptoms of long COVID include fatigue, shortness of breath, cough, joint pain, and chest pain. However, people have reported a combination of many different symptoms, which include shortness of breath, constant fatigue and tiredness, brain fog, characterized by difficulty in thinking and concentrating, cough, chest or stomach pain, headache, heat palpitations, diarrhea, joint or muscle pain, pins and needle sensation, sleep problems, fever, distorted sense of taste or smell or both, and mood swings. In addition to these symptoms, people may also develop long-term complications that affect different organs of the body. These include inflammation of the heart muscle. One study found that 60% of the people who recovered from COVID-19 experienced heart inflammation, which could lead to symptoms like shortness of breath, heart palpitations, and increased heartbeat. Abnormal lung function. One consequence of severe COVID-19 is the possibility of permanent damage to the lungs. However, experts believe that the recovery is not out of the question, but it would take months to recover completely from the damage. Severe kidney injury. There is a possibility that kidney damage due to coronavirus could turn into a long-term thing, where the patient would have to resort to regular dialysis. How would the doctors diagnose long COVID? Unlike the coronavirus, there is no single test to diagnose long COVID. The doctor will have to look at the symptoms of the patient, study his medical history and the evolution of COVID symptoms from the time of getting infected. In addition to that, he may check out the blood pressure, heart rate, temperature, and breathing function of the patient to further confirm things. Finally, since the COVID symptoms are pretty general and could mean anything, he might run a few tests to eliminate the possibility of other conditions that might be causing the symptoms. Depending on the symptoms, he may check full blood count, electrolytes, liver and kidney function, heart muscle damage, heart health, and iron levels. By doing so, he can have a much clearer picture of the root cause of the problem, and if it has anything to do with long COVID. Prevention and management. Now comes the big question. Can long COVID be treated, or is there a way to avoid getting into this long trouble? Unfortunately, there are no cures for long COVID, as is the case with COVID-19. However, the best way to save yourself from long COVID is to avoid getting infected in the first place. Now, we don't need to repeat the mantra that you've been listening to for the last couple of years now, that you should wear a mask in close quarters, maintain a 6 feet distance, wash hands regularly, and all the other protocols. Also, getting vaccinated should be a priority, as it will not only reduce the likelihood of you catching the virus, but can also keep you from developing long COVID symptoms even if you've already been infected, as research shows that the prevalence of long COVID symptoms is a lot less in vaccinated individuals than in unvaccinated ones. If you're experiencing the symptoms of long COVID, then certain strategies can help you in dealing with the symptoms. These include over-the-counter pain relievers for relieving painful symptoms, resting and relaxing, following a healthy diet, getting good quality sleep, limiting alcohol intake, limiting caffeine intake. However, since the symptoms of long COVID vary greatly from person to person, there may be a need for a more personalized rehabilitation plan for specific symptoms. The symptoms of long COVID could take a toll on your body, but the psychological impact should also not be ignored. The long persisting symptoms could drive a person into depression and could make them lose hope. That's why there's a need for a social network that would help the patient pass through the difficult phase of their life. Although the general symptoms of long COVID are troublesome on their own, a patient should seek medical help immediately if they experience a worsening breathlessness, unexplained chest pain, weakness, changes in vision, hearing, and speech. Recovery time. Just like the symptoms vary from person to person, so does the recovery time. Some research suggests that the symptoms could persist for 2 or 3 months, while others mention a longer period than that. Some people have continued to experience the symptoms for more than 6 months, while others reportedly are carrying the symptoms even after a year from the initial infection. Why do the recovery times differ so much? And is there a chance that the symptoms would never go away? These are all the questions that the researchers and the medical community are trying to find an answer to. However, due to the novel nature of the virus, it could take some time to finally make some sense of this virus. Until then, the only thing that you can do is to not lose hope. Practice good health habits and regularly get yourself checked. And most importantly, keep adhering to the COVID protection protocols. Finally, to summarize, long COVID or COVID long hauler is a post-COVID condition where a person continues to experience COVID-19 symptoms even after testing negative for the COVID-19. According to the WHO, if the symptoms persist longer than 3 months of contracting COVID-19, then it is termed as long COVID. Research shows that 10% of the COVID-19 patients go on to develop long COVID. These symptoms could manifest in anyone who has been infected with the virus, and it doesn't depend on the severity of the symptoms. Although there is no clear evidence as to why this happens, some researchers and doctors suggest that it might be due to an overreaction from the immune system, or maybe the virus never left the body. Most commonly reported symptoms of long COVID include fatigue, shortness of breath, cough, joint pain, and chest pain. The only way to avoid long COVID, it seems, is to avoid contracting COVID-19 in the first place. For that, you should prioritize getting vaccinated and keep following the COVID protection protocols. With that, we come to the end of our video. We hope that you benefited from this video. If you did, please hit the like button and share this video with your friends and family. Want to see more videos like this one? Please subscribe to our channel, Welcome to Wellness, and press that bell icon as well so you never miss another video. We'll see you in another healthy video. Until then, take care.